Okay, welcome everyone. My name is Pedja Stojicic, and I'm the Executive Director of People Power Health. It's good to be here with all of you in this first panel in the series with the title, What Role Can Clinicians Play in Leading Change in 2025? And I'm so glad to be among amazing leaders here joining us for this panel. Starting from my left, joining us today is remarkable Dr. Lisa Patel, a pediatrician, advocate, a global change maker. Lisa's journey has taken her from Stanford to Brazil to India and then back, all with a focus on building healthier communities and healthier planet. She's the executive director of the Medical Society Consortium on Climate and Health, a passionate champion for kids, climate, and equity. Whenever she's working on newborns, shaping, supporting them or shaping national climate policy, Lisa brings her heart, her expertise, and unwavering commitment to the future. Welcome, Lisa. It's good to be with you here.
Thanks for having me.
Also, let's give a warm welcome to amazing Amy Staley. Amy is a nurse leader based in New York City, where she leads the neuroscience ICU and telemetry program at New York Presbyterian Hospital. She's passionate about supporting nurses and patients, and her work has made a difference. And I witnessed this firsthand in 91 countries through her work with Nursing Now Challenge Committee. Amy has spoken to the United Nations, like she partnered with WHO and Harvard, and she works tirelessly to make healthcare fairer and more accessible for everyone. So we're so excited to have you with us, Amy. Welcome.
Thank you so much. So excited to be here with you guys.
Yeah. And last but not the least, please join me in welcoming incredible Dr. Somava Saha. Shoma has spent 25 years improving health and well-being for people and communities around the world. She's the president and CEO of Well-Being and Equity in the World, or as we all know it, We in the World, and leads the Well-Being in Nation Network, both organizations dedicated to building thriving and equitable communities. Shoma works has touched millions, and I'm saying literally millions of people, through leading the 100 Million Healthier Lives initiatives and transforming healthcare here domestically, where I'm calling from, in Cambridge Health Alliance. I was preparing for this, and I've learned that she actually shared the stage with Dalai Lama in a similar panel. So Shoma, it seems like we're in good company, and we are so excited to have you with us today.
Thank you for having me.
Yeah. So before we go into questions and discussions for today, I wanted to share that this is also a special day for us as People Power Health, because today we are announcing the beginning of the Courageous Clinicians community. We've been working on this for the last 6 months, and I don't think there's a better place nor better people, nor honestly more urgent time for us to make that announcement and invite people to join us. The idea of Courageous Clinicians community is and will be a dedicated space for clinicians and public health professionals to learn and grow and lead change by practicing community organizing and movement building. We will talk about it later, but I wanted to share that is also really a special day for us, and having this panel and this discussion is really, really timely. So without getting too much into the news cycle, and I hope this conversation can also sane, I wanted to start with fresh news because it's on everybody's mind. This week, President Trump signed the executive order on initiating the United States withdrawal from WHO, World Health Organization, and Paris Agreement. No matter where you are on a political spectrum, I think we can all agree that this has consequences for people's health and our ability as clinicians to actually support that. I've been talking to a lot of people this week, and everybody's trying to make sense of it. How do we make sense of what it is? What does it mean for US and for globally? Because we have a global audience here, like people around the world asking them question, what does this mean and how is it going to affect the people? So I want us to engage in that conversation. And Lisa, I want to start first with you because I know Paris Agreement and all of that has a huge impact on climate, and some of the conversations regarding what's happening in California as well. We are sending our love to and support to the people who are going or went through the fires. So I want to start with you and then invite Shoma and Amy to, as we go, reflect on their own thoughts and sense making of this.
Thanks, Pedja. And I just feel so honored to be in a space with such amazing folks. Yeah, so making sense of, I live in San Francisco. I have become what I call myself an unfortunate wildfires expert. It wasn't what I dreamed of being when I was a little girl, but because I live here and I have 2 young children, I became an expert on wildfires because it's affecting the health of our children and all of our populations, particularly the ones that are made more vulnerable by structural factors like poverty and racism. The Los Angeles fire every fire is different and devastating in its own way. And I think the Los Angeles fire has been really devastating because most of the fires that I've covered anyway or worked on, it's been mostly there aren't a lot of people there. It's huge amounts of biomass that are burning and then a lot of the smoke. This one, though, happened in a highly populated area. And so not only did lots of people lose their homes, their churches, their schools, but now they're living in essentially a toxic wasteland. And so there's so many layers of grieving that people are going through, and the grief of losing communities and homes and all the things that connect us to one another, but also the grief that this place is now toxic. And we don't know how long it's going to be toxic for the people living there. How this ties into the Paris Climate Agreement, unfortunately, there are people that have the microphone right now who are saying that the cause of the wildfires are all kinds of nonsense when we know that the reasons why this wildfire was so horrific was because of climate change. We know that these disasters did not need to reach this scale. We did not need to see this amount of human suffering and loss. And so how do we make sense of, how do we funnel people's anger and anxiety towards action, especially in this moment where we are moving backwards by withdrawing from the Paris Climate Accord? I do feel a lot of hope in the global community, because what happened the last time is that the global community said, well, U.S. can do whatever they want. We are going to move forward because we know what is right. And I hope that continues to be the case while we get our act in order in this country on climate.
Yeah, that makes a lot of sense, Lisa. And I think you're absolutely right. It's kind of like now is the time to think about how we can get involved. Amy, I know you've been doing your work with WHO, and I wanted to kind of like invite you to comment on that as well.
Yeah, for sure. I think that in general, there's just a lot going on in the world that we really can't make a whole lot of sense of. I think that as a nurse and as a healthcare worker, the most important things that we as clinicians should focus on right now are making sure that our patients know that we are here and that we will always be here to care for them regardless of gender, identity, nationality, birthplace, all those different demographics. And I know, the WHO, the U.S. pulling out of the WHO was definitely a surprise to hear this week. I know that many of us know the U.S. was a founding member of the WHO in 1948. In addition to all of the efforts made to end smallpox and eradicate polio, the WHO has also just done a tremendous amount, especially in the past few years since I've started working as a nurse, to support my profession. The chief nursing officer, Dr. Amelia, is extremely supportive, not only to the nursing profession, but just for women in leadership roles in general. I actually had the opportunity to meet with her during Nurses Week in 2024. And when I met with her, I learned that women comprise 75% of global health roles, but only 25% of them hold leadership positions. And that is a statistic that I know Dr. Amelia is currently working to change, and that several others in the WHO are working to change. I think that, one day we'll shatter that glass ceiling, and it'll be because of people like Amelia who hit it with everything they had first. But yeah, in general, I just think as nurses, healthcare professionals, it's crucial now more than ever that we support our patients and put the people in our communities above profits. And I am hopeful as well that we'll be able to find unique ways to support these diverse populations that we will continue to serve regardless of the changes that get implemented.
Yeah. Amy, thanks for that. And I wanted actually to build off of that and invite Shoma to comment. I know, like, traditionally, like as medical professionals and clinicians, we're focused primarily on clinical duties. And that is our first, for most of the people, that is the first kind of like thing that they want to do. However, what is happening right now domestically and globally, are we in a different moment? That is, for me, a big question. And, would you advocate for more people to get involved into 2025 beyond the clinic, and why is that? And Shoma, I wanna invite you to comment on this one first, and then Amy and Lisa, feel free to jump in as well.
Yeah, I think we've been in a different decade, not just a different moment. At least that's from my perspective. In reality, as a primary care doctor who had the great privilege of getting to listen to and be with families from, the earliest days of their life to the latest days of their life throughout the whole lifespan, which you quickly saw if you were a practitioner in the safety net across our country, is that the health and well-being of people were connected, and that they couldn't be solved by what we could do in our exam room alone. And we could optimize everything about that encounter and help our healthcare teams be fully up and working fully during that encounter and between encounters. But much of where health and well-being was determined often predated birth. And we know that because two kids born in the same hospital can grow up 2 miles apart and have a 20-year predictable gap in their life expectancy. We can't fix that after the fact in our primary care offices, our pediatrician offices, our hospitals. It's not possible because those are driven by systemic inequities that set us up. But I would say that the very same things that are causing us to pull out of the Paris Accord and the World Health Organization is this belief that in scarcity, and that in order for me to win, you have to lose, others have to lose, and that in fact a false hierarchy of human value is normal. That in fact it is normal that some people should have everything they need, and that others at the expense of others who don't. And if we understand that false hierarchy of human value is unfortunately not only rooted in our nation, it's actually rooted in all nations in many different parts of our world. It's not uniquely American, but we have become really good at it because we excel at many things. We understand that, in reality, that scarcity mentality means we don't distribute healthcare resources enough in a way that keeps us safe. That in fact, it's that scarcity mindset that threatens our health and well-being, just as our inability to see and invest in with an abundance mindset, as we have in the past in things like the World Health Organization, that actually protects us. It gives us the tools and intelligence and data and ability to solve problems together as a global community, as we were able to do during the pandemic, for example, to develop solutions together. That when we try to hold that in America First policy, that we in fact threaten our own health. We put our own health at risk. Just as when we apply a policy of racial and other inequities, of saying that rural places should get less investment, of that people who are poor in communities that are poor have a right to fewer healthcare resources, and that we shouldn't invest all along someone's life. We should only invest at the end of someone's life, which is where we spend half our healthcare dollars. We bankrupt ourselves and lose the ability to invest in a way that creates well-being for everyone. So I'd love for us to understand that an America First policy is a policy that is harmful to our own health and well-being.
Yeah, and it is interesting how those types of policies always backfire on the very ones that are actually introducing those policies. Lisa, I saw you kind of nodding while we were listening, actually both of you, but I invite you, from your perspective, what does this moment require of us?
Oh yeah, no, hard cosign to everything that so much is said. So I'm a pediatric hospitalist. I work at a small community hospital, mostly with FQHC patients, federally qualified health center patients. And so I attend deliveries, and I'm taking care of those FQHC patients in the nursery before they go home. And absolutely, what I'm able to do in that hospital setting is a fraction of what's going to determine that child's health. So much of it was determined by what prenatal services the pregnant individual had access to, whether they had access to nutritious food, mental health services, the healthcare that they needed, whether they lived in a safe neighborhood, right? All of these factors are so much more important than the medicines or the therapies that we deliver inside our clinic and hospital walls. And so, I mean, we have various estimates of how much of health is driven by what we call the social and structural drivers of health. And I've seen estimates anywhere between a half up to 80% of health outcomes are driven by those factors. And so if we care about health, we have to move outside of our clinic and hospital walls, and we have to take up advocacy, because the policies are really what are driving our patients' health. And that's where we need to make sure that we have policies in place, as Soma was referring to ensure that there's equitable distribution of resources. It shouldn't be that some people have everything and others have nothing. And that's not a world in which we can thrive.
Yeah, that is a really important perspective. And I think that also requires a level of kind of like solidarity, even among ourselves as clinicians. And I know there's an upcoming WHO report on the state of nursing that is, I think, going to be published in April. So Amy, what is your take on that? Like, you know, how that solidarity we need to show to our patients and our communities, but what about us as caregivers as well? Like, you know,
I love the points that both Somava and Lisa brought up. I mean, reduced inequities, I think, is one of the most important United Nations Sustainable Development Goals. And both of you highlighted how important it is to address those social determinants of health and make sure that, you know, we're serving these patients as best we can. You know, in regard to advocacy in general, I think that as a nurse, as a doctor, as a medical professional, I don't really think it's a choice to be an advocate. I actually think it's an obligation that we have to all of our patients. I can tell you one thing, either you're going to shift the energy in the room or the energy is going to shift you. And we should want to be the voice for changes that occur within our healthcare systems. We all know that nothing in healthcare is fixed or static, right? It's ever changing, and we definitely need to advocate for more people to get involved to improve access to care. I know that's something that in New York we're really focusing on right now. And also just in general, there's a lot of issues throughout the world. Community health workers still aren't paid an adequate wage. And if we don't pay for that now, we're going to end up paying more for it later. I also think in regard to advocacy, it's important for people to see themselves. And I think that nurses and doctors and healthcare professionals can learn to clearly share their stories. I know People Power Health really helped me do that and learn how to share my story in a way that is both professional, but also moving for other people that are like me. So I would say, in summary, you can join the movement or you can be moved by what somebody else chooses for you. It's important to realize that our advocacy efforts don't have to end in some big success story to be impactful or make a difference. And, you know, a little book of failures could also be considered a collective stories of effort and intention and, you know, us just trying to make something better. So I think even just having somebody look at something a little bit differently or having somebody hear you out hear something from a new perspective is still having an impact. We're not obligated to finish the work, but we're definitely obligated to start it as healthcare professionals.
Yeah, I love that, Stamy. And I particularly love the fact that, you know, if you are not choosing to participate, it actually, the world events and what's happening around you might choose you. So it's this illusion that we, you know, by kind of withdrawing, we can actually avoid, which I think it's really, really problematic. And I'm so glad that you're sharing that. But having said that, I want to problematize it a little bit for us, like here, because it's part of the of this question: what is the role of us as clinicians? I also hear a lot of voices saying, "Well, but it's too dangerous. Like it is risky right now. I can risk my job. I can risk my practice. Like through that, I can also risk the ability to serve my patients." And I always thought that the courage is not the absence of fear, but the strength to rise above it. And I know through your life and career, like all of you has demonstrated the courage. So but at the same time, like, you know, you might have some fears as well. Like, so when you think about ahead and think about 2025, what keeps you up at night? You know, what is it that really is kind of like, oh, like I really, really need to be mindful of this so I can find the courage to deal with that. And Sho, I'm gonna start with you because we've been doing some amazing work with Justin Squared in the last couple of months, and we wanted to invite you to share about it.
You know, I was raised as an immigrant in this country to be grateful, and I'm so grateful for everything this country has given me and my family in terms of opportunities. And immigrants were often trained to be grateful and to fit in and to not speak up, to not be courageous. But I come to realize over time that it's actually our ability to speak up for one another as well as speak up for ourselves that's going to be part of how we get through this moment. You know, that there's a poem by Pastor Martin Niemöller that many people have come to know that was in a time where different groups were being selected, that in fact, divide and conquer has always been the strategy of those who have tried to create injustice. And that, you know, it's at first they came for the communists and I didn't speak out because I was not a communist. Then they came for the socialists and I didn't speak out because I was not a socialist. Then they just named group after group after group. And then they came for me and there was no one left to speak out for me. I think the only way we make it through this time, what gives me courage is the ability to say that what for me as a physician who is committed to my life, to improving the health and well-being of people and communities, is that I have the courage to speak out for other groups, not just for my own group and not just for my own rights. The reason that's important is because the way we fight a divide and conquer strategy is by coming together in a unite and be in shared community together, not even against those who see and are struggling with such a terrible case of scarcity that they can't imagine a future where we can thrive. I can't think of a worse fate than that. But rather, on behalf of everyone, to say that we can, in fact, if we come together in ways that aren't just about speaking up for justice for one another, but about how we can bring our assets together to create, to own and acknowledge where we have injustice in our nation, injustice in our healthcare system, and in practical ways come together to put our pieces together to say, how do we both heal where there's been harm, and how do we build for justice that we may actually be able to create a just system? And the reason we know we can is because we built an unjust system, so we must be able to have everything we need to build a just system, right? And it's not someone else, it's us. We are the ancestors for the healthcare system of the future, the one that will be there for my children and your children and your children and your children. And so what's the healthcare system? What's the community? What's the nation that I want to leave behind for my children and our children? That's the one that I want to spend my life building. And that is an invitation back to why each of us, I suspect, when many of us went into healthcare in the first place, it brings us and restores something in ourselves. It doesn't just give us courage. It gives us hope and grace and power. Not power over, but power on behalf of, power together, power in a way that we can rest and be in joy. And I think the initiative that we've been building, Justice Squared, is about building justice together, but it's also about discovering the joy and humanity of when we choose to lean into being the ancestors that can create the health system that we all need for our children and each other's children. That's one where we can rest secure in.
Yeah, that can be a tremendous source of courage and hope in a way. I always love the framework of kind of like better ancestors, like how we can kind of like not just think about ourselves, but our future. So I was wondering, Lisa, what do you see? Like, what are the examples of that happening? Because I want us to also give people a sense of, yes, this is a real moment and what keeps us up at night, but also like, what are we seeing that is already changing that moment or has a potential to change that? So I don't know, Amy or Lisa, like what are you seeing out there?
Yeah, I would say I think I have been seeing too many examples of lack of courage when we're talking about like all the Silicon Valley bros that have kissed the ring before the administration even began. I did see yesterday that the Costco shareholders voted 98% to beat back an anti-DEI initiative. And so things like that do give me hope that there are people that are willing to stand up and fight. We can think about the word ancestors not needing to be in this current moment because the stories we tell in this household is of Rosa Parks, of MLK, of Mahatma Gandhi. And I think about Gandhi and the walk that he did for the Salt March that he did that inspired millions of people all around the country. And so one of the things that I always hold on to, and what I've been telling, because I've been hearing a lot of fear from a lot of the students that I work with, is that there are so many more of us than them. So many more. And so they can't come after all of us, And so we need to stand up. And I think it's incumbent, especially for those that occupy positions of privilege. People often say, especially in academia, they're like, Lisa, like, you're so outspoken. Aren't you scared? I'm like, what are they going to do? Fire me? Like, there's a healthcare shortage in this country. I'll find another job somewhere else, but I'm not going to stay silent. I will find a place to work. I have that privilege, right, of being able to find another place to work. And I need to use that in this moment to make sure that other people are seeing instances of courage as well. Because if there are no instances of courage, we are social creatures. We look to others to see what we should be doing. And if nobody is out there speaking out, we can't expect that nobody else is going to either. So I really appreciate the work that y'all are doing on raising up more courageous folks to speak up in this moment, because again, they cannot come after all of us.
Yeah. And that sense of community that you're talking about, that is actually really, really critical. Amy, I know you acted with a lot of courage in the past, so I'm curious, what are you seeing out there in the world that gives you the special way to overcome fear?
I think that in regards to hope, I always hope that more like politicians and policymakers and these people in charge will bring nurses and doctors and advocates like Lisa into the conversation. But I think where the courage comes in is where we realize that whether we're brought into the conversation or not, they're going to hear from us anyway. I think that having made a recent kind of career transition, I worked on an orthopedic floor up until about 8 months ago. And in orthopedics, like, you see patients get well pretty quickly. They usually come in with a fracture or something small on the floor that I was working on previously. And back in June, I made this transition to work in the neuro ICU. And I think I've learned a lot about hope just from being in this new setting. Before I started the role, the day before I started my job, June 19th, I went to Trader Joe's and I was in the card section and I saw the bereavement and sympathy cards. And I thought to myself, I should get some of those to have in my desk, because how nice would it be for the nurses and doctors to be able to give the family, a card if they lost a loved one. So I bought 20 of those cards. I put them in my desk drawer. And today it's January 24th, 2025, and I still have all the cards that I bought. Because I haven't had to give out a single one, because people don't come to the neuro ICU for healthcare. They come here for a literal miracle. And I think the outcomes that I get to witness every day from the nurses and doctors that I work with, who, of course, I'm biased, I believe they're the best in the world, but that just gives me hope every day. And if I were to have the opportunity to speak to somebody who was seeking courage or feeling hopeless, I would just remind them that where you are and where we are as a nation today is not who we are. I would say that our work has meaning, even if we can't see the impact right now, and it doesn't decrease or diminish the value of what you're doing just because you can't necessarily see the outcome or the impact of what you're doing. And lastly, I would just encourage people to keep moving, because a stumble is still a step in the right direction, and there might be heavy work ahead for all of us, but with the greatest need definitely comes the greatest impact. So it's worth it.
Yeah, I love that, to ground ourselves in the healing process that we've been trained how to do, and somehow I feel in certain moments we kind of forget about it. Like, we forget about the miracle of healing, both in a immediate practice of clinicians, but as well as societies. And growing up in a country that doesn't exist anymore, and that went through a lot of transitions, that power of communal healing is a really powerful one, and really something that can connect a lot of people. So thanks, Amy, for reminding us of the healing miracle that we all witnessed, both in the practice and then we can actually create in the world as well. So we often say that the leading change is not a solitary effort. It's not something that you do alone. And it should not be. Honestly, I was never a fan of lone wolf activism. Oh, let's go do something by myself. So I'm curious about, who are your go-to communities? Who are you going to? Who are the individuals? What are their stories? And what are you seeking to get out of them? And the reason why I'm asking that is that I think a lot of people right now will be in search for the community, as they are maybe witnessing something for the first time or trying to kind of figure out how to lead change. I've known, like, we trained over 500 people over the last 3 to 5 years, and every time we talk about our trainings, people say, "Oh yeah, the trainings are great, but the community was even better." And I'm always like a little embarrassed, like, okay, like, that is nice, but I also see an enormous value of finding your people. So who are your go-to communities these days, and what are you seeking to get out of them, or what are you seeking to give? So Lisa, maybe we can start with you, because I know you're cultivating one that is pretty influential these days.
Yeah. I just feel so great. The work is hard. Absolutely, it's hard, but it's also been so rewarding in terms of all the amazing people I've gotten to meet over these years, and we all hold each other up in the moments that we need to be held. And so, like, I have my moments when I'm really struggling, and I just have a group of people that I can text with as many expletives as I need to get my feelings out. I send the folks that I know are struggling care packages. They send me care packages in return. And these are folks both local. I started my organizing work here in the Bay Area amongst 3 of our academic institutions. And so I have both that local context, but then I also just have these folks all over the country, and I'm really grateful for them. And this is what I say over and over again when people ask me, like, what can I do for climate? We actually know from the literature that if you try to go at this on your own, it'll be a boomerang effect where you'll feel worse than when you started, because it is a big, overwhelming problem. And so community, I tell people again and again, find your people, find your community, because not only is it the best way to make change, it's also the most important way for you to sustain yourself in your work.
Yeah, I love that. It's really like, it is a sustainability question. Like, how do we sustain over a longer period of time, and that what community can bring and give you. Shoma, we were together in San Diego last week, and I witnessed, like, in the last 6 months, how you were building the community in real time. So I'm curious about who is your go-to community, like for you, for your support, and kind of like when you're seeking answering the questions or grappling with the questions.
My community is really broad, in part because it's less defined. So while there may be initiatives like Justice Squared, which brings together a collective of people who I think of as like heroes individually, but who know that it's by coming together that we can build a just health system. So on the one hand, it's communities that are for a particular purpose. But if you really look at who's in those communities, they span a wide range of other kinds of communities and groups. And that ability to know that there are people who are striving to build a world in which everyone can belong, and in which everyone can have their best possible life and health and well-being, in which everyone can contribute, to be part of communities that range from people who are social justice leaders who lost limbs in attacks because of their courage in the fight for justice in South Africa, and turned to healing and what that meant to be a healer to those that had perpetrated injustice to them, all the way. Those are the ones I turn to in my moments of anger and heartbreak, to think about how I deal with that, all the way to people who are in communities as community change makers, to people who are system leaders. And I think it's actually the wealth of your community is, I think, the wealth of that's who I think of as my wealth, is that, this morning I've spoken with a national leader, and I've spoken with a youth and generational Black farming leaders, and I've spoken with health system leaders, and any one of them has been all of them in different ways have been sense makers for me and are a resource for me. And I think it's that ability to be grown by others, to not be the ones who have to be the heroes, but to be the ones who get to be in community that is incredibly capable together. That's where my abundance and community and sense of joy and hope in not just this moment, but over the long term really comes from.
Yeah. So I really love that. And especially when you were talking about like these 3 particular people, like, for example, how all of a sudden, like, we sometimes lose perspective that our relationship with people around us is almost like our sense-making network. That is how we make sense in the world, not just by sitting down and kind of like contemplating about things, but actually by relating to other human beings and what they can offer and what we can offer to them. That is the true meaning of sense making. And especially the reason why I'm lifting that up, because I think the moments of uncertainty like we are living right now, and we have been living for some time, I think it's not a new thing just this January, those moments require sense making. And they are actually, the reason why the stories and people kind of create these narratives is because they're trying to make sense of the world. And if they're doing it alone, then what happens is this kind of like I'm telling like people do, this is like radicalized by algorithm. Yeah. Like people just like are processing alone, and then they can come to really weird conclusions where if they were in a community, that might be a different outcome because both of those interactions among people. Amy, I knew you were part of the global community that I'm a big fan of, like a Nursing Now challenge that started as a challenge, but then became like this family of people. So I don't know if you wanna speak a little bit about that. And I'm super excited about doing some work with them again this year.
Yeah, Nursing Now is incredible. My community are definitely my nurses, my colleagues. Nursing Now is has this amazing portion of it. It's huge, but it has this amazing portion called the Challengers Committee, which is a committee that I have the privilege of leading alongside my colleague Sana. And within that, the nurses are broken up into the 6 regions of the WHO, and it's all early career nurses, which is amazing. And you just have this fresh new perspectives, and the energy is just incredible. Another organization that I often rely on is Sigma Nursing. Sigma is another global nurse network. They do so much for the community and really just like the community that I live in as well. My supervisors at work, Patty and Joan, are just like the most incredible humans, the most genuine people. They hear my unhinged ideas and they're like, let's go for it. And I think that those are the kinds of things that I seek when I'm looking for that sense of like togetherness and unity. And sometimes just validation as well. Like sometimes it just takes one person to remind us that like we're capable of doing, something that's unthinkable and new. And I think it's also important to remember that no matter who your community is, like community works faster than the government. Some solutions, might be in your neighborhood or in the building that you live in or, in your workplace. And I think it's really crucial to rely on each other. And it's really important to feel that sense of unity and community.
Yeah. I love that the community works much faster than the government, which
With
might be
respect to the government, yeah.
really, really true in this moment in time. And like just being part of the Nursing Now community, I was just like, honestly impressed by not by just like support for the work, but the genuine care that the people have for the events that are happening. This is a global network of nurses around the world, and I tend to be on the WhatsApp group and to see like people supporting each other in really difficult moments where some of the countries were going through some struggles and wars and just like celebrating successes. That for me is a really true value of that work and tremendously impactful. I know we're kind of like entering the final phases here, and I don't want to leave this conversation without asking you about self-care, and not in a sense of like, oh, we're gonna do some yoga and light some candles, but really like if you think about this idea of balancing clinical responsibilities that most of you have and kind of like a lot of people that are trying to embrace this work and advocacy are balancing that and then activism, and both can be really demanding. And what I hear a lot is like, oh, is this another thing that is going to contribute to my burnout? How do you manage self-care in this space? And what does it mean? What does it even mean for you to actually care, not just for the communities and for the people around you, but also to preserve yourself? Because after all, without you, some of those things cannot exist and cannot have an impact that they have right now. So I don't know, Lisa, what are your thoughts on that? How you're, even within the medical consortium, what type of conversations are people having about this?
Yeah, no, it's tough for sure. And I was reflecting a little bit because I have staff that are younger and I work with a lot of students. And one of the things that I feel sad about is that I'm approaching 50. And so I've had periods of like relative civilization stability to figure out what my toolbox is for self-care. But what I feel sad about for the generations below me is that they are like feet to the fire, having to figure out those self-care without any real stability around them to be able to have that time and space to be able to figure that out for themselves. So I would say it took me some time to find a clinical job that did not drain me. And that was part of my equation of not feeling burnout. I'm really grateful for my clinical job. I get to be there to see babies come into the world. It is such a privilege. And so I would say I'm probably unlike most clinicians in that my clinical job actually keeps me sane. And it is my climate work that drives me insane. So, but to your point about the majority of clinicians, especially given the way our healthcare sector is going, where we're asking more and more of a smaller and smaller population of healthcare providers, what I have heard clinicians say is that this work actually gives them some respite because and I think Shoma had sort of named this before, is that it's not more work. It's sort of in a way like spiritual work that helps reconnect you to why you got into this in the first place. And so when our healthcare systems feel broken, I know for myself, and I can say this about many people in my network, I think they look at their work in advocacy for climate as sort of a salve for the wounds that come with those of us that went into this to try to take care of people, but feel like the system is set up against us to do that good work. I think in terms of self-care, I hate to talk about the yoga and the meditation. It drives me crazy because I don't think it's burnout. I think it's moral distress. But at the same time, I do think it's important to create a toolbox for yourself. Mine is I love listening to LeBron James on Calm. He's just got these amazing lectures. And I think one of the ones that sticks with me is he has this lecture on Rise Above. And it's the idea that we learn in all meditation, right? Which is to not let the chatter get you, to detach yourself when you need to give yourself that space and time. And so for me, I like to go out on walks where mindful walks where I'm listening to the sound of the wind and the trees and the birds and giving myself that mental break because we need it. We need it. We can't just power forward and our brains be consumed with everything that's going on. So that's a bit about how I think about it. And I'd love to hear how others are thinking about it.
That's great. Amy, what about you? What Lisa and I had a little bit of time to build the toolbox here, but I'm curious about your thoughts about it.
I love that. I agree with everything that Lisa said. And I think that other practices of self-care, would include just talking to yourself the way you would talk to somebody that you care about. They always say, leave people better than you found them. And you're really supposed to include yourself in that as well. My mom, Margie, is the sweetest, selfless, most perfect angel. And she actually has her own new self-care practice that she's using to deal with whatever's going on in the world and all the uncertainty. So I'm going to try her new practice as well. So Margie's practice is that first, you start every day by naming 10 things that you're grateful for. And then you send love to 3 people who bother you. And then third, you're supposed to be quiet and think about it. And I haven't figured out that third portion yet. I'm still working on it, but that's something that I'm going to be trying this year.
I love that. That's really cool. Shoma, what about you?
Well, now I have a new one. What helped me the most was when I went out of what has become a hero-dominant narrative that is it turns out, colonial narrative. I'm going to be the one that plants my flag. I'm going to heal you. I'm going to fix this. I'm going to be the innovator. I'm going to be the organizer. I'm going to be whatever that I is. And instead came to see myself as part of a community, a collective of healers that are creating generational change, that are wounded ourselves and need to heal ourselves even as we work to heal the world. That is, as we heal ourselves, as we care for ourselves, that is part of how we heal the world and create better change. And that we're not alone. We're joining generations before us and generations will come after us. And I think that reframe for me really helped me not be someone who is constantly reacting to the urgency of the moment or who feels responsible for being someone who has to come up with a solution. And in fact, by trusting in our collective capacity for not just healing, but brilliance of creativity. So it's not even that all of us have blind spots. And yes, I need you to see my blind spot. But what I'm really interested in is, what would you do that I couldn't even dream of doing? How can it's that celebration of who we are together and the trust that together we've got this, and together we can give and build a culture that is healing for each of us and for all of us. That maybe that's part of how we begin to create not just that sense of collective and abundance, but that sense that we have enough altogether for all of us.
That is so well said. And now we know why Shoma was on a panel with Dalai Lama. It makes total sense. It's really well said. And I think, the fact that understanding our limitations as well and our role in that sense is more of that a convener, someone who has given a chance to contribute than just, as you were saying, like putting a stake on something and saying like, this is what we have to do, or we are going to do. It's a different look at the world as well. I want to spend the last few minutes on getting a little bit practical and really asking you, like, what are your big plans for this year? We had an amazing conversation here about some of the experiences, and hopefully this was inspirational for people to learn how they can manage their own kind of like decisions and choices about what they're going to do in 2025. But what are you doing in 2025? And I know all of you have some big plans. So Lisa, what are your big plans for 2025?
I'm going to fight like a mother. That's what I'm going to do. So I'm the executive director for, it's called the Medical Society Consortium on Climate and Health. And we bring together 60 major medical societies plus 25 state clinician groups. And we are charging forward, working on climate, health, and equity. And we are doing so because this is the greatest public health crisis of the 21st century. And because we know that a majority of Americans are worried about climate change and want the government to act on it. And so this idea of you can't come for all of us, and the things that this administration is doing they're unpopular. And so we're going to hold them to it. So we're charging forward. While, work on a federal level is going to be more challenging, we're pivoting to doing a lot of work on a local and state level where we can get a lot done. And then we're doing a lot of defense work to protect everything that we were able to accomplish in the last 4 years.
Yeah, I love that. And I invite everybody who's maybe listening and haven't decided to come in March to be part of that big meeting to consider joining and really be there on even the to take action the Capitol. So that's pretty exciting. Shoma, what about you? What are your big plans for this year?
Oh my gosh, Pedja, I have a lot of plans for this year. One, we're in the middle of launching the Justice Squared, both the collective and that's a smaller group of 10 to 12 health systems that are really going to engage in a deep journey to address structural racism. I'm so proud that even in the context of this moment, over 110 healthcare systems rose up to say that they're going to take on structural racism. And to me, that is just such an act of courage for those health systems and their communities to come together to do that. And so building the Justice Squared community for those courageous health systems and communities to be on that journey. And of course, for those that are in the cohort and building who we are together. As we've been leaning into this movement of better ancestors coming out of the last several years, when you truly believe that abundance can make it possible to do many things, we brought together an unprecedented collaborative of Black, Indigenous, Latinx, migrant, older adult, all of the groups that reached people in the pandemic. And so those groups are coming together to say, how can we be that collective that is creating healing and safety and justice in the current context? And how could we be the better ancestors? So as part of that, we're really looking at how we safeguard common assets, how we share resources, how we support one another. In the last 3 years, those groups got over 11,000 people in communities experiencing inequities, not only had jobs, but they led strategies that put 200,000 birthdays back in those communities, put hundreds of millions of dollars of economic growth back in those communities, and built pathways of hope about how the system could be changed. And so those are not communities that don't believe they can't be part of changing the future. They're who we need, and we're supporting them to be the ancestors and saying, how might we and who might be aligned, and how can we leverage our common resources to continue to build what's needed. We don't need to wait for someone on high to do the work we can do already with what we have in our communities. And those communities are in every political geography you could imagine. And what gives me so much hope is how many good people are trying to create that change in every part of our country. And the last thing that I'll say is my family, we're getting a camper trailer, and we're just like, we love nature. So we're going to be going and visiting. And so we might show up at a community near you, but also spending a lot of time in nature. And so that time for healing and what we call random adventures and random community that we find, we're looking forward to some of that as well.
I love that. I love it. Those are really big plans. Get ready. I've been camping for years now, and it is quite a big plan to pull that off. Amy, what about you?
Yeah, I love that. I want to be a part of everybody else's plans. I'm like, these sound incredible. Outside of my
Be careful with that. You might get an invitation,
Yeah, it's amazing. Outside of my day-to-day in the neuro ICU, I was recently appointed into a new role as a United Nations youth representative with Sigma Nursing. So I'm hoping to influence policy and decision-making in that new role this year by bringing more nurses into these spaces. But last year, I also published my work to improve access to care for unhoused asylum seekers in New York City. So I'm hoping to serve that population in some capacity as well. Most of all, I just plan to be intentional in my actions, multiply the number of nurses in my profession, both locally and globally. And I think that, there's no right time to do anything. There's just time and how we choose to use it. And I plan to use my time before it runs out to impact my community and my profession.
I love that idea of multiplying. So we're at time. I want to thank all three of you for amazing conversation. If only the world can multiply you and us together so we can have like a more just world. But it was a really real joy on behalf of myself and PPH team to have you in this initial conversation. We're going to put some links and comments with the events that you're planning and the work that you've been doing. I really, really want to thank you for participating today and for joining us in this conversation. As for the big plans for PPH, as I said at the beginning, we are launching the Courageous Clinicians community in March, and that has been something that is going to be on our mind, and we're going to put a lot of effort in doing that. So we're going to use this opportunity to also invite people who are clinicians and public health professionals interested in building movements and building solidarity and building communities to join us in that. So thank you again, and looking forward to all the things that we're going to do together this year.
Thank you.
Thanks, everyone.